Hey guys, this is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 10 of my multi-part video series providing a broad overview of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. I'd like to open up by talking about the ankle jerk reflex. This is also known as the Achilles tendon reflex. This is examined by tapping the calcaneal tendon to provoke a downward movement of the foot at the ankle joint, known as plantar flexion. Both the sensory, afferent, and motor, efferent, components of this reflex arc are transmitted through the tibial nerve, primarily stemming from spinal nerves S1 and S2. Consequently, the ankle jerk reflex serves to assess the integrity of spinal nerves S1 to S2. Moving on. Next, we're going to be talking about a gluteal region injury known as the Piriformis Syndrome. Inflammation or involuntary contraction of the piriformis muscle can lead to discomfort resembling sciatic pain, a condition known as Piriformis Syndrome. The piriformis muscle serves as a pivotal landmark within the gluteal region, aiding in comprehending anatomical relationships in this area. Additionally, it influences the nomenclature of nearby blood vessels and nerves. Functionally, the piriformis muscle contributes to the supination of the hip joint, and as you can see here on the right, I have an illustration provided by the Cleveland Clinic that shows the piriformis muscle and the sciatic nerve and what occurs in piriformis syndrome. So, moving on to the next concept. Next, we have injury to sciatic nerve, where we have diminished hip extension and knee flexion. We have foot drop, characterized by the inability to dorsiflex the foot. We have flail foot, indicating a lack of both dorsiflexion and plantar flexion. The injury typically arises from improperly administered gluteal injections, but can also occur due to posterior hip dislocation. Once again, I have a picture on the right that kind of shows where sciatic nerve damage occurs and what happens with the knee. Moving on, I hope these illustrations help you guys. Going to some questions right now. So we have a 56-year-old male that presents to the clinic with complaints of weakness and numbness in his lower extremities. Physical examination reveals diminished ankle jerk reflexes. Which spinal nerves are primarily involved in assessing the ankle jerk reflex? Pretty first order question, but we'll give you guys a few seconds to think this through. Alright, think I gave you guys enough time. If you need more time, please feel free to pause the video. If not, moving on now. The ankle jerk reflex, also known as the Achilles tendon reflex, primarily assesses the integrity of spinal nerves S1 and S2. These nerves contribute to the sensory afferent and motor efferent pathways of the reflex arc, which are transmitted through the tibial nerve. Diminished ankle jerk reflexes suggest dysfunction at the S1 to S2 spinal nerve level, often indicative of conditions affecting the lower lumbar or sacrospinal cord segments. Therefore, the correct answer is S1 to S2. Moving on. S3 to S4, these spinal nerves primarily contribute to functions such as bladder and bowel control, sexual function, and sensation around the perianal region. They are not directly involved in the ankle jerk reflex. S2 to S3, while the S2 spinal nerve contributes to the ankle jerk reflex, the primary involvement is with the S1 and S2 spinal nerves. S3 is not directly implicated in this reflex. L4 to L5, these spinal nerves are primarily involved in functions related to the lower extremities, including sensation and motor control. However, they are not specifically linked to the ankle jerk reflex, which primarily involves the S1 and S2 spinal nerves. L5 to S1. The L5 and S1 spinal nerves contribute to functions such as sensation and motor control of the lower extremities, but they are not primarily associated with the ankle jerk reflex. The primary involvement in this reflex is with the S1 and S2 spinal nerves. Moving on to the next question. We have a 42-year-old female that presents with complaints of unilateral buttock pain radiating down the back of her thigh. Physical examination reveals tenderness over the gluteal region. She reports worsening discomfort with prolonged sitting, which condition is most likely responsible for her symptoms. All right, I think I gave you guys enough time here. I'm going to move on. If you need more time, please feel free to pause the video. Moving on now. Piriformis syndrome presents with buttock pain that radiates down the back of the thigh, mimicking sciatic pain. Inflammation or spasm of the piriformis muscle can compress the sciatic nerve, leading to these symptoms. Additionally, tenderness over the gluteal region and aggravation of pain with prolonged sitting are characteristic features of piriformis syndrome. Therefore, the correct answer is C, piriformis syndrome. Moving on to see why the other answer choices are incorrect. Hamstring strain. While a hamstring strain can cause posterior thigh pain, it typically does not radiate from the buttock region. Moreover, tenderness over the gluteal area is not a typical finding in hamstring strains. Gluteus medius tendinopathy. Gluteus medius tendinopathy may cause lateral hip pain, especially with activities involving hip abduction. However, it does not typically produce symptoms that mimic sciatica or radiate down the back of the thigh. Sacroiliac joint dysfunction. Sacroiliac joint dysfunction can cause buttock pain, but it typically does not radiate down the back of the thigh. Additionally, tenderness over the gluteal region is not a hallmark feature of the sacroiliac joint dysfunction. Trochanteric bursitis. Trochanteric bursitis presents with lateral hip pain exacerbated by activities such as walking or climbing stairs. While it can cause discomfort in the gluteal region, it does not typically produce symptoms that mimic sciatica or radiate down the back of the thigh. Moving on to the next question. We have a 34-year-old male that presents to the emergency department with weakness in his right lower limb following a gluteal injection. On examination, he demonstrates diminished hip extension and knee flexion. Additionally, he exhibits foot drop and flail foot on the affected side. Which nerve is most likely injured in this patient? All right, I think I gave you guys enough time there. If you need more time, please feel free to pause the video. If not, moving on now. The clinical presentation of diminished hip extension, knee flexion, foot drop, lack of dorsiflexion and flail foot, lack of both dorsiflexion and plantar flexion following a gluteal injection is consistent with injury to the sciatic nerve. The sciatic nerve is the largest nerve in the body, comprised of branches that innervate the muscles involved in hip extension. gluteus maximus, knee flexion, hamstring muscles, and foot dorsiflexion/plantar flexion. Peroneal and tibial nerves. Improperly placed gluteal injections can lead to direct trauma or compression of the sciatic nerve, resulting in the observed symptoms. Therefore, the correct answer is C, sciatic nerve. Let's go ahead and see why the incorrect answer choices are incorrect. We have the femoral nerve. The femoral nerve primarily innervates the anterior thigh muscles and does not contribute to hip extension, knee flexion, or foot dorsiflexion/plantar flexion. Therefore, is unlikely to be involved in the described clinical presentation. We have the obturator nerve. The obturator nerve innervates the muscles of the medial thigh and does not contribute to hip extension, knee flexion, or foot dorsiflexion/plantar flexion. Thus, it is not responsible for the symptoms described in this case. We have the tibial nerve. While the tibial nerve is a branch of the sciatic nerve and innervates muscles involved in foot plantar flexion, it does not contribute to hip extension or knee flexion. Additionally, injury to the tibial nerve alone would not result in foot drop, lack of dorsiflexion, therefore is not the primary nerve involved in this scenario. Peroneal nerve. The peroneal nerve, also a branch of the sciatic nerve, primarily innervates muscles involved in foot dorsiflexion. However, it does not contribute to hip extension or knee flexion. Additionally, injury to the peroneal nerve alone would not result in flail foot, lack of both dorsiflexion and plantar flexion. Therefore, while the peroneal nerve may be affected, it is not the primary nerve responsible for the entirety of the observed symptoms. Alright guys, that will do it all for this video. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. As always, this is a nice broad overview for anatomy. We'll be going into deeper details in the MSK High Yield Review series when I get to making that. If you like this, feel free to leave a like and subscribe for more content like this. This is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying, and goodbye.